Now that we're inducting you into the honorary class for the top blacks in healthcare, we're family. And family means that if you need anything from blackdoctor.org, our organization, we're here for you. And we're going to support you because we understand that all ships rise with the tide. And we also want to say thank you for your leadership, your sacrifice, your dedication, and for your outstanding achievements because you're helping to lead the way. And we need you to continue to lead because we have others that will follow the path.
On behalf of Mayor Stephanie Rawlings-Blake and also our Health Commissioner, Dr. Lena Wen, I just want to say congratulations to blackdoctor.org and to the top blacks in healthcare. We're so proud to have this event, this gala, for the third year here in Baltimore.
And I want to say thank you to Black doctors and Johns Hopkins. And I want to ask everyone in the sound of my voice to join together with them and with us and do what you can so that we can eradicate this from the boardroom to the hospital room.
Man, it's good to see you. A lot of you I saw last year. I was here last year, so I'm honored to be back again tonight.
And whatever I can do for this organization, you guys, you got me. This is part of my soul now, so thank you very much.
Michelle Obama once said, when you walk through that door of opportunity, you do not slam it shut behind you. And I am so grateful that an organization like blackdoctor.org and Johns Hopkins did not slam that door shut, but instead they are addressing the healthcare disparity that is paralyzing and crippling our community.
As you guys are mentoring people, that's the one thing that I would leave with today is to encourage everyone to go after their passion, and we hope that their passion is healthcare because as we're all aging and the population is aging, we're going to need more of them to take care of us.
I have grandparents. I have family members who have suffered from the diseases that we talk about, and I feel it is my obligation where I realize that there is no monopoly on good ideas. It is global, and so my job is to go find them, and I will do that.
Because it's so important to make sure that children have a good opportunity to really be the best that they can be. And part of that is their oral health.
Every day, every hour, every encounter is an opportunity to lead. Whether you're being a good father, whether you're being a good son or a good daughter, you have the ability to impact lives. What you do and how you treat people matters.
Extend my thanks and appreciation to blackdoctor.org for bringing such a serious message to our community multiple times a week, whether it's about heart disease or shampoo or new diets that can improve our lives. They're doing a tremendous job, and I want to just acknowledge Reggie for his vision and care of our community.
And there are many people who need help, and I would have been one of those people many years ago growing up in a rural area in Georgia. And so I understand that life. I understand what it needs. I understand what it means to lack access.
I currently lead Regional One Health in Memphis, Tennessee, a community where there's significant healthcare needs and opportunities. In a state that did not expand Medicaid, so we still have considerable amount of uninsured. But we are focused to make sure that we deliver the highest level of care to each individual who comes through our door.
What I do remember is what she said to me. And as I was finishing up trying to move her along and move on to my next patient, out of the blue almost, she said, "I'm proud of you." And she said, like Joe Louis, you know, when he came back from that big fight, he had won, and we were all so proud of him. Well, that's how I feel about you. You're young, you're black, and you're a doctor.
Every day that I speak to my mentees, they teach me something new. And we have to, as leaders, always be open to continuous learning. And when we talk to young people, they're the ones who are creating blackdoctor.org. Did you see who was up here?
It's a good country, but it will be a great country when we finally eradicate the healthcare disparities that are plaguing peoples of color. So I salute Black Doctor organization and the work that all of you are doing.
For me, Tally and Twine represents the intersection of where you started and where you finish. And we say at Tally and Twine, you don't have to finish the way that you started.
What we do or what we have done is not for recognition. Our conscience, our very humanity, compels us to act to confront and to demand remedy wherever and whenever we're confronted with inequality, injustice, racism, and any other form of bias.
I want to say on Dr. Elder's behalf, she said that she wanted me to say thank you to everyone, to blackdoctor.org, and to the organization Johns Hopkins Center for Health Disparities, emphasis on solutions.
I hope the folks that are here tonight who are being honored, you find that you can establish partnerships with each other among ourselves, because we're all in it together. In order to make a difference, we all need to work together.
Throughout my career, I've had a chance to be part of some transformational parts of healthcare. I'm dating myself here, but some of them include the creation of INRs, intravascular pacemakers, transcatheter valves, making glucometers smart. And what's been cool about that is not only that you help the therapy, but you also help bring future leaders into the industry to help bring those therapies to the people that need those.
Whether it's Chicago or San Francisco or Oakland, wherever it is, we have a responsibility to move away from just taking care of sick patients to creating healthier communities.
Tonight is a time for celebration and acknowledgement, but it's also a call to action. A time for us to raise awareness in our communities, to expose programs and services that are available for those who live in our communities so that health and wellness becomes a reality for us.
America's becoming brown and black, and in 2050, we're going to be the majority of people in the country, and we're going to need healthcare providers who look like us.
In the mission to curb health disparities, physicians are no longer the center. We are a healthcare team, and we're going to need everyone, including our nursing colleagues, dentistry, pharmacy, lawyers, social workers, public health officials. Everyone needs to collectively solve this problem. We're not going to solve it alone.
To the young people, realize that you will have many, many ups and many, many downs, but be strong in your faith and recognize that we as a people have come a long ways, and you will be that group of individuals that push us even further.
I appreciate this very much, and I take this honor from my staff, because they actually do the work. I come out and take the bow, so thank you very much.
I'm excited because I have one of the greatest jobs in the world. Every single day I get to go to work and have an opportunity to have an impact on the people in this very community. And so to me, that's truly an honor.